April marks International Immunization Week, bringing together partners from across the world to promote the use of vaccines that protect people of all ages against diseases. Spearheaded by the United Nations Children's Fund, UNICEF, and the World Health Organization, the theme for this year's World Immunization Week is Long Life for All. This year's theme highlights the immense historic achievement of vaccinations across the globe. For over 2 centuries, vaccines have helped protect children and adults from serious and deadly diseases. Vaccines are among the most advanced achievements of modern science, decreasing by half infant mortality and saving millions of lives throughout the world. Despite their vital nature, vaccines, like all other medical supplies, have been barred from reaching Tigrai, with an estimated 200,000 children in Tigrai said to have missed their vaccine shots this past year. Last year, the World Health Organization warned that the war on Tigray and the consequent disruption of health services could lead to the spread of deadly diseases. The WHO stated that from January to November of 2020, over 400 cases of measles in children were reported, and that with disruption to route vaccination, this number may increase significantly in the near future. Over 9,000 cases of malaria were also recorded, and when compounded with malnutrition, fatality due to malaria among children can increase up to 3-fold. But one of the most highly affected members of the community are IDPs, with more than 2 million internally displaced persons living in overcrowded facilities across the state and have no access to clean water or proper nutrition. Dr. Sofanias Malako and his teammates at Maadot have been working to ensure that IDPs have access to free and equitable health care.
Through our work, we were able to provide free health care to almost 300,000 IDP throughout Tigray. And we've been able to provide a service to our people in need.
Dr. Sofanias says the most widely spread communicable diseases are infectious respiratory diseases such as COVID-19 and tuberculosis, acute diarrhea, scabies, and not to mention sexually transmitted diseases. The collapsing health system, according to Dr. Sofanias, makes the situation even worse, allowing the disease to spread faster and more widely.
We don't have medications. The diseases are getting more complicated and difficult. We could have managed them months back. We can still manage them now if we act promptly.
Dr. Sofanias emphasized that conflict-affected areas are potential hot zones for the emergence or resurgence of old and rare diseases, and says he fears that if the world doesn't take decisive action to curb current trend in Tigray, the situation could present a threat for global health.
So imagine the world as one small village where you'd have different houses. Some are flimsy and small, some are very big and nice looking, but they're all connected by narrow corridors. So if you have a fire that would erupt in the small and flimsy house, the people of the neighborhood or the village would be wise to put it out, right? Because that fire does not stop there. Fire is contagious and it will consume everything around it. So let's look at this disease as that fire. We are allowing this disease to fester here, and we are not looking at them as we should. And neglecting to act now and ignoring the suffering of the people here will be ignoring the suffering in the world for the future, because these diseases will spread.
Dr. Sofanias called on the world to be on the right side of history by helping save the lives of millions in Tigray being denied access to health care.
This conflict is going to pass. We're going to forget about it someday. But history will not forget who did what and how we acted. And we should all stand in the right side of history. And we should not accept human suffering.
According to the World Health Organization, close to 4 million people in Tigray are in urgent need of medical care, as the Ethiopian government continues to block the delivery of urgently needed aid into Tigray.